The pre-op report tells us the configuration for the osteotomy guide, including the proximal pin, distal pin, and the stop pin. Place the configured guide on the bone, aligning the proximal pin to the patella tendon insertion. Holding the central pin only, check the positioning pins are in contact with the cranial tibia. Drill the central pin unicortically and ensure it is perpendicular to the plane of stifle motion. Drill the oblique locking pins bicortically. Remove the positioning pins. Trim the locking pins if necessary. Drill a 1.5 mm single trocar pin bicortically at the planned rotation. Remove the central pin. Perform the osteotomy using a cruciate saw. Use copious lavage and maintain blade alignment with the guide. Replace the central pin to check alignment. Drill a 3 mm pin unicortically into the proximal segment. Rotate the proximal segment until the guide contacts the stop pin. Drill a 2 mm anti-rotation pin bicortically through the crest and proximal segment. Remove the rotation pin. Remove the central pin. Remove the stop pin. Remove the oblique locking pins. Remove the guide. Compress the osteotomy along the anti-rotation pin with pointed reduction forceps. Position the plate according to the pre-op report. Ensure the proximal screws are centered on the proximal segment and the distal screws are centered on the diaphysis. Drill and place the screws according to the specific plate selection. Once complete, remove the pointed reduction forceps. Remove the anti-rotation pin, and compare the completed construct to the pre-op report.